Hi, welcome, and thanks for joining us today. I have the pleasure of introducing one of our graduates from Bastyr's MACP program, Teresa Peterson. Welcome. We're so happy to have you with us to talk about your experiences and just where you are now in life and in your profession. Teresa is a 2020 graduate, and so a few years have passed, but if it's okay, Teresa, I thought we could go back a little and talk about your experience with the program, maybe some highlights that stood out to you, things that you were exposed to that really had prepared you for where you are now. So yeah, just kind of if you think about your first and second year, just anything that stands out for you and you'd like to share with us.
Yeah, absolutely. I'm glad I get to be here and see you and talk about Bastyr because I'm obviously a big fan. I think when I talk to people about my experience at Bastyr in general, the thing that stands out the most, among many other things, is our opportunity to work in the clinic and have that experience before our practicum placements, before our year of clinical experience, in that the supervision, the way that it's set up, is really unique in that we had the opportunity to have live supervision. And I honestly think that sets me apart then and also now, because it gave me a level of confidence in knowing I've been seen practicing in person, live. So that's one thing for sure.
That's great. And then, yeah, and it is a unique experience. And you're right, not many programs have that live supervision piece. So it's really nice to get feedback in the moment and then have the support of your peers as well, since we try to keep those groups very small. But yeah, absolutely. It's good to hear it's prepared you as well for your profession. And then if you can think of maybe some classes that stood out to you, or again, things that you reflect on now with any of the material or experiences you've had with the classes, if you could think of any.
Yeah, definitely. I think one thing for sure is just having a small cohort size. That was really helpful to always get to have the opportunity to ask questions and have genuine dialogue with each other, not only to get to learn from you guys, our professors, but also each other. One class that really stands out every day for me would be our mind-body course that we were able to take. It's just not something everybody else gets to do, and it's so applicable. It's the ability to kind of look at someone as a whole person and also have some interventions that I learned in school that make it not just knowledge, but applicable knowledge. That's definitely one of them. I think too, our human sexuality course was unique in that way we covered certain diagnoses that are particularly challenging that have to do with human sexuality. In that course, we took a perspective, we took our time to have various perspectives and conversations about those types of things that I also just in conversation with my colleagues now, I don't know that everybody had such a unique experience in that class, that kind of class. Yeah. I think one other one that I think is really important to identify would be, obviously learning how to be a counselor, doing our counseling, our triads where we would sit and have someone observe and someone practice and then someone be the client, and just doing that all the time was super helpful. We did that a lot, which that was what prepared us for the clinic on campus, and then the clinic on campus prepared us for our practicum. So there's really smooth training transition points that made it much less anxiety provoking to get started. But the other class that comes to mind is just our diagnostic class, learning about psychopathology and learning how we don't always want to just over pathologize people too, kind of learning a different perspective on diagnosis that I think is really useful. Yeah.
That's great. So what I'm hearing is a lot of this integrative, whole person perspective, which has been helpful in this program to kind of, again, see people from different angles and different domains. And then, yeah, some of the classes that you're mentioning, yeah, they're wonderful and they are unique. And it's good to hear that you've had like a really wonderful experience with them that's prepared you. And you mentioned and it's set up in a way where role play is incorporated a lot. So you get a lot of practice with your peers before you then, and you're observed as well by your professors. Then you go to the clinic where you're observed again. And you mentioned anxiety producing. So yes, can we talk about that just a little bit and kind of how you dealt with that kind of initial fear of, wow, I'm going to be sitting in front of someone and being observed, and I don't know how I'm going to do this. Like, what has helped you become comfortable, especially in that first year of just kind of saying, well, this is it, and this is good practice for me?
Yeah, it's a good question. I think being encouraged to have a beginner's mindset, being encouraged to expect yourself to be learning and to not have all the answers all the time, or to allow yourself to be a beginner. I think that's what makes me confident in my clinical skills even now, is that every year I gain more knowledge and more practice and more experience, and I still let myself be a beginner. And I think that makes me that's part of what makes me a good clinician. And I really feel like I learned that in all of our classes. It's never to think that you have everything figured out.
That's great. Thank you for sharing that. And then as we think about your second year at Bastyr, can you talk a little bit about where your practicum was, your experience during that time, and then again, what has helped you to prepare yourself for where you are now?
Yeah, definitely. So for me, I chose to work at an inpatient psych hospital, just like a higher acuity, a higher need in population. And that's a population that I don't work with now, but I chose that to feel like I had a really well-rounded level of experience. I worked in a clinic at Bastyr, and I worked, in a psych hospital. And then actually, because we graduated in 2020, we started to learn how to do telehealth right off the bat too, which was really actually a really nice pivot that I was able to also incorporate that into my experience. So that was unexpected, but again, a useful transition in my education at Bastyr. But I think the process of just getting into practicum in the second year was really, I think that can be really daunting for folks. And I felt super supported by Dr. Shuttleworth and you and everyone else that kind of helped answer questions. And I felt like we were going to get into where we needed to be, no matter what hiccups might come up along the way. So I felt really confident that I could trust the process. And yeah, I like I said, having that experience in like that practicum placement in a psych hospital, particularly, I work in private practice now. So that really set me up, I feel, to have just a more grounded perspective in dealing with some of the tougher stuff, when you're dealing with suicidal ideation or, things that I think can be really scary for clinicians, understandably so. I feel like I was able to have a really relevant perspective into like how that can present in so many different ways. That leaves me feeling like I really know how to assess risk. I really know how to keep my client feeling comfortable and safe, and not have it be about my own fears around those things, because I learned in so many different settings how to stay grounded, how to stay assessing, how to keep everybody, open and present and safe, essentially.
That's wonderful. And you mentioned for you right now, private practice is your profession. And can you talk a little bit about that experience and how you got to that point and some of the things that have been rewarding for you right now?
Yeah, absolutely. I think, well, number one, I feel really grateful to have landed in private practice just as an associate out of school. I think a lot of folks take a path that is maybe a faster way to get your hours so you can work towards licensure. And for me, part of what I feel I was given the opportunity to decide for myself at Bastyr was just like the trajectory I wanted to take as a clinician. And so I felt like I was going to find something that felt aligned, you know, it felt aligned with my personal values, aligned with the way I wanted to live my life. And so I held out for a private practice opportunity, and it's worked out really well. There were some, you know, trials and tribulations along the way, but I really love what I'm doing now. I work with a wide variety of people. I have a really excellent supervisor who I feel super supported by, and I know what kinds of questions I needed to ask them to make sure I would be supported based on what I learned going through the practicum and the clinic and the classes at Bastyr. Does that really answer your question?
It does, yes.
Okay.
Yes. So yeah, private practice, and that is where you want to stay. Are you finding that to be a rewarding experience for you?
Yeah, I love it. I think it's great because for me, part of being a therapist is also walking the talk and living a life that feels enjoyable for me. And so I get to work in a private practice where we do get to see folks who need a sliding scale, or folks who can pay a full fee, or, you know, who need a super bill. And I think that's really rewarding for me because I get to show up authentically because I'm taking care of myself, but I'm also able to help people figure out how to take care of themselves in that setting. I really love it. I get to make my schedule, and I get to, you know, consult with my colleagues. I work in a group practice, so I have a community, and that's really important to me, to find that. If you went the private practice route, it can be really isolating. So we have a really good team, which is what makes it sustainable for me.
That's wonderful. I'm glad that you found that. Well deserved. In our last minute, how about self-care techniques, things that you do to keep yourself grounded and present, and in just good spirits, because it can be heavy work.
For sure. I build into my day-to-day like time to do the things that I love, that light me up, that let me get out of my head, that let me get into my body. You know, I don't want to identify with my job. That's something I love, but I'm a person as well as a therapist. And so I try to make sure I have time to be a person and not always be a therapist, and that like I make time to do jujitsu or yoga. I also have my own therapist, so I have support. And I think that's so important. It's not something everybody does because you don't have to, but I think it makes me a better clinician because it is, again, walking the talk and practicing and being supported, letting myself receive as well as holding space for other people.
That's fantastic. Thank you. Teresa Peterson, thank you for joining us today to talk about your experience at Bastyr University with our Masters of Art Counseling Psychology program. I know I speak for myself and Dr. Shuttleworth that we are so grateful that you came back to share your experience after a couple of years of graduating, and we're so proud of you, and just love hearing all of your experiences and the clinician that you've become. So thank you. And as always, if anyone is interested in learning more about our program, Bastyr.edu is the quickest and easiest way to connect online and see the programs, the breakdown of the classes. And then, of course, we have some other videos up as well with interviews. So again, Teresa, thank you so much. We're so grateful for your time, and continue to do wonderful work in the field. Thank you.
Thank you.
Take care.
Likewise.